trying to quit. Nicotine inhalers haven't been studied as much for helping youth to stop vaping. However, we know some people do find them helpful, particularly when used under healthcare provider guidance for a limited period of time as part of a plan to cut down or quit. If your healthcare provider recommended the inhaler, using it correctly makes all the difference. Here's how it's done. The nicotine inhaler comes with two parts, a mouthpiece and a nicotine cartridge. Step 1. Twist the mouthpiece to line up the small ridges, the bumpy grip marks, and then pull it apart into two pieces. Step 2. Insert the nicotine cartridge into one end of the mouthpiece, then push and twist the mouthpiece together to close. Step 3. Place the narrow end of the inhaler in your mouth and take short, shallow puffs. This allows the nicotine to be absorbed through the inside lining of your mouth. You may notice a mild taste while using the inhaler. Avoid inhaling deeply, as this can irritate your throat. Inhalers do not deliver nicotine to the lungs. Avoid acidic drinks like coffee, tea, soda, alcohol, or citrus juice for 15 minutes before and while using the inhaler. These drinks can reduce how much nicotine enters your bloodstream and make the inhaler less effective. It takes about 20 minutes of continuous puffing to empty one cartridge. However, you should stop as soon as you feel all your withdrawal symptoms disappear or you feel you have had enough. When you're done, or when there is no longer a taste when you puff, remove the cartridge from the mouthpiece and throw it in the garbage bin, away from other people and pets who could choke on the cartridge or get poisoned by the remaining nicotine. Hold on to the mouthpiece as that should be reused. And don't forget to clean the reusable mouthpiece regularly with soap and water. It's important to remember nicotine inhalers are not the same as e-cigarettes. Inhalers are produced as a medicine and have a higher standard with respect to safety and quality. They are made so the concentration of nicotine in each cartridge is the same. They are approved by Health Canada for smoking cessation. They do not have a battery. They do not have multiple flavors. And they do not deliver nicotine to the lungs. You are taking a huge step towards gaining control of your health. Quitting may be tough, but your healthcare provider has suggested using the inhaler to make it easier to quit and stay quit. For more details, including possible side effects, check out the pamphlet that comes with your nicotine inhaler box.